Hello everyone, and welcome to our channel. Today, we're going to talk about a newly widespread virus in China, the Human Metapneumovirus, or HMPV. Should you be worried about it? Let's find out. Recently, there's been an increase in HMPV cases in China, along with other flu-like illnesses. But what exactly is HMPV? HMPV is a respiratory virus that causes symptoms similar to the common cold, such as cough, fever, and nasal congestion. It was first identified in 2001 and belongs to the same family as the respiratory syncytial virus, RSV. The symptoms of HMPV include cough, fever, runny or stuffy nose, sore throat, and wheezing. In severe cases, it can lead to bronchitis or pneumonia. HMPV spreads through droplets from coughing and sneezing, close personal contact, and touching contaminated surfaces. Children under 5 years old, older adults over 65, and people with weakened immune systems are more vulnerable to severe illness from HMPV. China has seen an increase in HMPV cases, but there has been no official declaration of a public health emergency. The Chinese CDC reports that HMPV is responsible for a portion of respiratory illness cases and hospitalizations. To protect yourself from HMPV, practice good hygiene by washing your hands regularly, wearing masks in crowded areas, and avoiding close contact with sick individuals. While there is no specific vaccine for HMPV, getting vaccinated against influenza might help reduce the risk of co-infections. Could HMPV become as widespread and severe as COVID-19? While HMPV, Human Metapneumovirus, and COVID-19 are both respiratory viruses with similar symptoms like cough, fever, and sore throat, they belong to different viral families. HMPV has been known since 2001 and typically causes mild to moderate respiratory infections, especially in young children, older adults, and those with weakened immune systems. Unlike COVID-19, HMPV doesn't have specific antiviral treatments or vaccines. However, it can lead to complications like pneumonia and bronchitis in vulnerable populations. While HMPV is not as virulent as COVID-19, it's important to monitor and manage its spread to prevent severe outcomes. In this part of the video, we will hear from Dr. Nahid Bhadelia, the founding director of the Center for Emerging Infectious Diseases at Boston University. She will explain more about this virus and share some precautions we should take.
Yeah, and I want to begin by underscoring what Shaquille said, which is that this is highly contagious. I mean, it takes very few viral particles to transmit this, and this kind of runs through like wildfire in communal living spaces and nursing homes and cruises. This is why you're seeing such a rise, and within families it becomes harder too. So the transmissibility, the contagiousness adds to it. But if I were to guess, I think there are a couple of reasons that I can imagine why. One, there's always a surge in the winter. It's possible that we haven't seen as high numbers in recent years because we weren't mingling as much for a few years during the pandemic. And, now we've changed our behaviors. Potentially, we're not being as vigilant as we should be with washing our hands, disinfecting surfaces. And second, maybe because we haven't had as many outbreaks, potentially we don't have as much immunity to some of the strains that are transmitting. Those are some of the thoughts I could think of, but we don't have a definitive answer except for the fact that it's very contagious, but very easy to protect yourself if you.
As we wrap up, we've learned that while HMPV shares some similarities with COVID-19, it's a distinct virus with its own unique characteristics. It's crucial to stay informed and take appropriate precautions, especially for vulnerable groups. Thank you for joining us today, and a special thanks to Dr. Nahid Bhadelia for her insightful explanation. Remember, staying informed is our best defense against any virus. Be sure to subscribe to our channel for more updates and health tips. Stay safe and take care.